Temporomandibular joint. Or sometimes known as temporomandibular disorder. Also has been known as myofascial pain dysfunction. Is one of the major causes of headaches, and massage therapy has a very definite place in helping with the symptoms caused from temporomandibular disorder. People who have headaches are very widespread. You are not alone. Over 45 million Americans suffer from headaches and migraines. Almost 1 million Americans experienced a headache, a migraine yesterday. Over 3 million Americans went to the emergency room seeking relief from headaches in the year 2010. Migraine represents one of the most active patient communities on the internet, with over 1 million related searches every month. Two types of headaches: primary headaches and secondary headaches. Primary headaches are like a migraine, which is disabling headache. It usually happens on one side of the head. It also is accompanied by many sensory symptoms like sensitivity to bright light and to loud sounds. The other type of primary headache is called a tension headache. Tension headaches are the common kind of headache, usually of muscle origin. This is also the type that we see with temporomandibular dysfunction. And cluster headaches are a little less common than the other two, but are very much more common in males rather than females, and can last for weeks at a time. So migraines are considered of vascular in origin. Besides pain, there's extreme sensitivity to light and sound. Tension type headaches originate from muscle spasm or from myofascial pain dysfunction syndrome. Acute trauma or chronic postural positioning contribute to tension headaches, which bring on the muscle sprain and strain. Temporomandibular dysfunction or disorder is the most often falls under this category of tension headaches. There are dozens of other subcategories defined by the National Headache Society. Well, just taking medication for all these headaches is a short-term solution, not a very good long-term solution with all the side effects that drugs do have. What dentistry has learned about treating pain from sports medicine: the function and range of motion of the jaw is critical to help with pain relief. Treatments pioneered in treating professional athletes have been adapted in the treatment of dental patients for temporomandibular dysfunction. Dentists can manage headaches and pain by controlling all aspects of the rehabilitation. So TMJ disorder involves all three: the teeth, the muscles, and the joint. So we get pain from the tooth. This pain can be a pain coming from the nerve of the tooth, inside the tooth, called the pulp. This will sense cold sensitivity, which comes from clenching or grinding. It is an inflammatory response. Fortunately, it is usually self-limiting after a few days or a couple weeks. Hot sensitivity is an irreversible symptom of the nerve dying, and most likely at that point you'd need either the root canal or the tooth removed. Tenderness when chewing is sensed by the nerves outside the tooth in the bone. They protect the bone from being injured. So clenching our teeth while we're awake or grinding our teeth while we are asleep will make teeth hurt to chew food and can also cause the cold sensitivity. So when these teeth touch together, it's like up to 25 times an hour, but it's only for 1/10 of a second, and that's to enable us to swallow. By bringing your teeth together, it helps to anchor the supra and infrahyoid muscles. And when our swallow lasting should only last about 1/10 of a second. If it's lasting longer than that, we are clenching our teeth. Inside of our tooth, there's 5,000 neurons. And by irritating those neurons in the teeth, that can cause tooth pain. And our chewing system itself inputs 2/3 of all the sensory input into the trigeminal nerve. Teeth do not actually touch when eating, but come within 1/100th of an inch of each other. If teeth actually came together every time we were chewing, we could damage the bone around the teeth. So our chewing muscles, the masseter is our big, powerful chewing muscle. The next biggest muscle is the temporalis muscle, which helps to position the jaw in the right place, getting them in the right position to do the big crunch and chew from the masseter. And the medial and lateral pterygoids, more palpable from inside the mouth, are helpful with even more precise positioning right to left of our jaw. They all can develop spasms or trigger points. Collectively, they can create up to 5,000 pounds per square inch on a tooth. That's how we break our teeth and create soreness in the jaw. When teeth don't match together, they start a little tug of war between the muscles that want to open our mouth and the muscles that want to close our mouth, trying to get the right position. Causes of clenching and grinding can be any one of or more of these, as could be crowded teeth, could be chronic pain elsewhere in the body, like a pain in your ankle, knee, hip. So every time you take a step, you feel that pain, your teeth will clench. People who are perfectionist personalities, everything's got to be just right, just perfect all the time. People that have repetitive lifting of objects of 20 pounds or more, like UPS drivers, FedEx drivers. Emotional trauma and stress also tends to create more tension in our muscles. Or inadequate airway in the nose or throat. If we don't have good drainage in our nose, our teeth clench together to help shift the bones around, to help those passages through the nose and the lymphatic system work better in draining mucus out of the nose area. And inadequate airway through the throat leads to sleep apnea. So the forces of fulcrum on the joint is right in front of the ear opening. And the great big masseter muscle lifts up as a class 2 lever. And the temporalis muscle helps position and come together. And that can put a lot of force into that jaw joint. Inside the mouth, the lateral pterygoid and the medial pterygoid attach. Inside, the lateral pterygoid specifically attaches to the TMJ, both the head of the bone of the mandible called the condyle, and another part of the same muscle attaches to the disc. So if there's excess tension in the lateral pterygoid, it can pull that disc out between the bones and cause disc displacement. The function of the temporomandibular joint is shown in the left as a normal position, and as we start to open it, does not leave the joint. It just rotates for about an inch, and then after it gets more than an inch open, the bone comes out of the joint and slides across. So it's a rotating and a sliding joint. If the disc that's between the bones gets out of place, we have what we call a displaced disc. And that's when the problems begin. Okay, so we've got the diagnosis done. Treatment will take some time. So for now, immediately, let's treat the symptoms without drugs caused by the source, and then treat the source. So first line of attack is plastic splints. They take some time, but some don't always work or make it worse. Immediately, we can use massage therapy for immediate relief of pain, numbness or burning, and then later maintenance. So the TMJ migraine pain, first thing to use is a plastic guard, but it's not usually only enough. That's why most treatment by dentists fail. Guards only help to remove the cause for only 50% of the time, and can create sleep apnea 40% of the time. Other healthcare providers that can help: chiropractors with the neck, neurologists with some drugs, physical therapists with helping improve the range of motion, psychologists with talk therapy, roofers to help realign the fascia, chronic pain physicians usually use steroid shots, Reiki energy work. Psychiatrists can help with depression, medication for that. Yoga can help with stretching. So massage has a direct and immediate effect on those muscles, easily applied. To get rid of the spasms or the trigger points, which are created in these muscles. Can have direct pain in and around the TMJ, or we can have referred pain going behind the eyes. So massage to do is to decrease muscle soreness, decrease the pain, increase the circulation, increase the healing time, increase the range of motion, increase effectiveness of other therapies.
I could see a difference in the first couple of sessions. I felt like there was definitely some days when I absolutely didn't have a headache, and I hadn't experienced that for a long time. I felt almost like something was missing.
It wasn't until, after maybe 2 treatments, I felt really nice and I wouldn't have the headaches anymore, maybe once in a blue moon. And then one day I was driving and I was like, oh my gosh, I haven't had a headache in forever, and my jaw isn't hurting, and it's just helped so much.
I could tell a difference from the first treatment, and I didn't expect it because I was told it might take 3 treatments, and I went home and I was like, I could have, it was amazing. It didn't hurt. I chewed on the first time in years on this side of my mouth. So that was, and I kept waiting for it to wear off, and it never wore off, and it's not going to.